Hello, and welcome to Radiation Therapy's question and answer email video. This person writes, Adam, 760 divided by pressure times temperature plus 273.15 divided by 295.15 equals temperature / pressure correction. Looking at the formula, I can tell the following. 760 is your atmospheric barometric pressure at sea level. 273.15 is the Kelvin temperature constant, and the 295.15 is room temperature in Kelvin. 0 degrees Celsius equals 32 degrees Fahrenheit equals 273.15 Kelvin. 22 degrees Celsius equals 72 degrees Fahrenheit equals 295.15 Kelvin room temperature. So I understand the values in the formula, but if you could tell me how this correction is implemented and why, would be great. Thanks. This correction is used whenever you take a dose reading and air is involved. As you know, air is a gas, and gases themselves are affected by many variables. So whenever air is involved and we're measuring radiation, we're pretty much measuring how many electrons are being given off. And when the electrons are given off, this can be translated into current, which then can be translated and correlated to how much radiation is in the area, so to speak. Air falls under the ideal gas laws, and basically these laws state that depending on your temperature, pressure, and a whole bunch of other variables, it determines what happens to the gas. In our case, we're just going to concentrate on temperature and pressure, and if you change your temperature or pressure, you will have more or less air molecules in a given area. So if you have the same amount of radiation, but you don't have as many air molecules being ionized, then it would appear, because of our measuring tool, that we don't have as much radiation, when in fact this may not be the case, because this is a product of the air itself. Basically, it's another variable influencing our measurement. So essentially what the pressure and temperature correction factor does is it normalizes everything to a reference standard. Thus you're taking the variable of the amount of air molecules in an area out of the equation. So let's look at this equation and try to make some sense of it. Let's first look at pressure. So here we have 760 divided by pressure. And 760 is our barometric pressure at sea level. So let's say we measure a pressure of 780. So all we do is we take 760 divided by 780, and we get a value of 0.974, and this is our correction value. So we would take this pressure correction value times whatever our radiation measurement value is. So let's say we measured 100, just to make the math easy. Simply take 100 times 0.974, and our new radiation value would be 97.4. So as pressure increases, we have more air molecules. Thus, more ionizations will occur. And basically, with the pressure correction factor, all we're doing is we're scaling our measurement down to correctly correlate to an accurate value. Now let's look at the temperature correction factor. We will say our reference is 295 Kelvin. This is at room temperature, so the equation looks like this. X plus 273 divided by 295. X is supposed to be measured in Celsius. So let's say we measure a value of 28 degrees Celsius. This becomes 28 plus 273 divided by 295. And this is 301 divided by 295 equals 1.02. Again, take our measured radiation value times your temperature correction, and let's say we measure 100 times 1.02 equals 102. As you can see, as you increase your temperature, we have less air molecules. Thus, we will measure less radiation, and we have to apply this factor to scale everything up to get our true measured value. And before we continue, as a side note, because I forgot to mention it earlier, 760 is measured, for our pressure, is measured in millimeters of mercury, and I forgot to mention that, so I apologize. And as well, I just want to warn you, I gave you pretty extreme examples here. Most of the time when you're applying the pressure temperature correction factor, it's a lot more subtle than that. But I just wanted to show you the extreme just so you guys could see the numbers changing. So finally, we just need to know when to apply this correction factor. And unfortunately, the answer I have for you is it depends on the measuring tool and your clinic. Pretty much anything that's dependent on air to take your measurement and is not a closed system will probably need this correction factor. And what I mean by that is I know some ionization chambers are a closed system, meaning that there's no air moving in or out of it. And with that, you don't need to apply this correction factor because you're going to have the same amount of molecules that you're irradiating. Those, I think, need to have some kind of leak test or something like that to be done just to make sure that air is not moving inside this chamber. I'm not 100% sure on that. Again, you'll have to check with your clinic. But pretty much anything that is not dependent upon air, perhaps maybe diodes. I know at our clinic we use a profiler. All those system or measuring tools don't need this correction factor applied to them. So pretty much just check with your clinic, and there also may be other factors that you need to apply depending on your situation. As always, if you have a radiation therapy question, do not hesitate to email me. I will attempt to answer the best that I can. And my email is adam@rt-review.com. And be sure to check out my website, rt-review.com. Thanks for watching.